Yes. Now, today is World Cancer Day. To speak to us about this day and how the country Uganda is faring, we have Dr Nixon Niyonzima, the Director, Laboratory Services, Research and Training at the Uganda Cancer Institute. A very good afternoon, sir. Thank you for joining us.
Good afternoon.
Indeed. Yes. Let's kick off with how Uganda is faring against cancer. Talk to us about that and a lot more.
So the theme for this World Cancer Day is closing the cancer care gap. And we are looking at eliminating the barriers that prevent people from accessing quality cancer care.
What kind of barriers?
Yeah, and the barriers have been characterized into 7. One of the barriers is gender, and gender looks at really whether you're male or female. We know that women have barriers in accessing cancer care because of their gender. They don't have finances to go for care, but we also know that some diseases like breast cancer, when you talk about mastectomy, which is cutting off the breast, it's an image problem, but also psychological problem. Cervical cancer presents sexuality challenges. For men, prostate also poses the same challenges, but also know men can be economically unable to come for care at the Cancer Institute.
I see.
Yes.
Well, as the Director of Laboratory Services, Research and Training at the Uganda Cancer Institute, we want to know, have we made any progress when it comes to eliminating cancer?
We have made progress towards managing cancer. I do not want to use the term elimination just yet, but we're working on strategies to reduce the burden of cancer in the country. So we have strategies to do cancer prevention. Including
increasing diagnosis?
Yes, so prevention is in many ways. One of the ways is primary prevention, so we're looking at healthy lifestyles that prevent people from getting cancer. We have vaccination for hepatitis B, for human papillomavirus, and all these are strategies designed to reduce or to prevent people from catching cancer. But also have early detection and early diagnosis. And as a Cancer Institute, as a country, we have actually made a lot of progress to diagnose cancer early and also detect them early, so that we diagnose our patients in early stage cancer, meaning that we're able to actually manage them better and also increase survival of our patients.
So elimination of cancer is far-fetched, but if you can get a diagnosis early enough, you have higher chances of survival. So are we educating our people on early diagnosis?
Yes, we are. Just for information, in Uganda, about 80% of the patients we get are in stage 3 and stage 4.
Yes, Dr.
Now,
Nixon.
cancer is stage 1 to stage 4. Stage 3, stage 4 means that the chances of survival are much lower.
Indeed.
Now, we're working on strategies to make sure that at least 90% of our patients are in stage 1 and stage 2,
I see.
where it's easier for us to manage them and also to increase survival. So we have outreaches, we have communication messages, and we have also developed a national cancer control program that is highlighting the roles of everybody, the government, the individual, the leaders in the communities, their role in the cancer fight. And all these are designed at us working together to reduce the burden of cancer in this country.
Still on diagnosis, let's expedite that job right now. How do I know I have cancer, the viewer who is watching?
So the signs of cancer initially are relatively non-specific. So we look at weight loss, unexplained weight loss, more than 10%.
I see.
We look at chronic fatigue that cannot be explained. We look at fevers, usually evening fevers and night sweats. We look at unexplained bleeding. We look at any lump anywhere in the body, any swelling in the body that's not explained is also a cause for you to actually go for screening. Any pain that you cannot explain is also reason why you should go for screening. Any long-standing pain. So those symptoms are non-specific, but we advise that if you have these symptoms that you cannot explain, go to a hospital, get screened, and let somebody rule out cancer. This is the way that we're going to detect our cancers early and actually increase survival from cancer.
Now, we have a viewer who has been watching NTV at 1 during this interview, and they are actually saying some of those signs and symptoms, I have them. So what do they do if they find out that they have cancer? Where do they go?
So, I mean, if you have those signs and symptoms, our advice is actually go to your nearest health center.
I see.
All health workers are trained to recognize the symptoms of cancer and actually refer patients to a facility where diagnosis can be made and treatment done. In Kampala, you can come to the Uganda Cancer Institute. We offer free screening and diagnosis at the Cancer Institute. We also offer free treatment for all cancer types and all treatment modalities at the Cancer Institute. So go to your nearest health center, get tested, and then come to the Cancer Institute.
That is Dr. Nixon Niyonzima, the Director, Laboratory Services, Research and Training at the Uganda Cancer Institute. Thank you very much for speaking to us on NTV at 1 on World Cancer Day.